The next question is from Tom Clark at ITV. Tom.
Hello, Secretary. Thank you. Firstly, can I just get a bit more of an update on those new variants from both South Africa and Brazil? You mentioned we now have in the UK. Can you tell us how many cases of each and whether we have sustained transmission of them or whether they are very much isolated? Secondly, on the efficacy of vaccines against new variants, I think all the lab studies indicate that, yes, they will work well against the UK variant, but the real proof of that will be in data from the real world. What evidence do you have from the vaccine already rolled out that it is effective against the UK variants, and can you share it with us? And just finally, if we indeed do end up needing to do some sort of boost strategy with a new version of a vaccine, like perhaps the one being announced by Moderna today, what capacity do we have to do that, and will we mix and match vaccines if needs be?
Thanks very much. Well, I'll set out where we are on the variants identified here, and then ask Susan again to set out the details in terms of any future updated vaccine. But really, I want to precursor all of that by saying that I set out the numbers of the new variants that we found from South Africa and Brazil, set those out yesterday. These are very, very small numbers in the grand scheme of things. What matters today is that people get the vaccine when the NHS calls. On the new variants, we have identified and are putting in place what's called enhanced contact tracing, which means that for each one of those people who is identified as having a new variant vaccine that we are worried about from abroad, there's a special focus to the contact tracing to make sure that they and their contacts self-isolate, that we check that everybody self-isolates, they get all the support possible, because it is so important that we get those new variants from abroad under control. We have a high degree of confidence that this vaccine works against the what you call the UK new variant. I think it's best described as a new variant that was first discovered in the UK.
So there are 4 laboratories in the UK doing detailed vaccination and convalescent sera studies, and that's in Imperial, Oxford, and 2 PhD laboratories, Portendown and Colindale. The consensus view from those 4 laboratories have all done different experiments, is that the current vaccine works against the variant that was first discovered in the UK. That is very, very reassuring. We also know from following clinical cohorts where we are looking at everyone who's had prior infection and who gets a subsequent PCR that we can't see any change in the immune response and the reinfection rate in those that have had a previous infection through our routine data sets. We're starting to do that work on South Africa. The variant that was first found in South Africa, that hasn't reported yet, but we will continue to look and watch this, and we expect each of those sites to publish that data